science matters now, possibly more than ever. I was thinking the other day, if there's ever been a time that I can remember, when we've been just so attentive to the importance of scientific knowledge, scientific explanations and understandings. Certainly during the space race in the 1960s and 70s, or the nuclear arms race in the 1970s and 1980s, we paid a lot of attention to science. But now, every decision you make, whether you go to the store, whether you go to school, everything you do requires thinking about infections, about contagion, about transmission, about vaccinations. And so it's really important that institutions like the Science Museum continue this mission of educating the public and talking to people and creating these opportunities to share this knowledge. Obviously, not all the sessions are about disease, but this was a really good opportunity for me, not just to think about the history of the 1918 epidemic, but how to connect it to what's going on now. And so that's how I'm framing this talk. I'm going to share, I have this presentation on which I'm going to go through because it gives me a chance to talk about some specific examples from this period. I'm going to start with this letter, which was published in the December 1918 issue of Virginia Medical Monthly. These are free. Anyone can get to these through the Medical Heritage Library, which is a consortium of digital public libraries. And the letter was written by Dr. H.U. Stevenson from Kelowna, Virginia. And the heading was called Treatment of Pneumonia. But what Dr. Stevenson really wanted to write about, or what he was writing about, was specifically the use of a vaccine to treat influenza and pneumonia that he had tried out on his own patients. And so I've given you some text from this letter, which I'm going to read some highlights from. He began by talking about his experience as a physician. I have had, along with other doctors, this state a severe epidemic of influenza. Perhaps more cases because he's had to cover for some other doctors who've been sick. I've had around 450 cases in all, plus another 35 cases of pneumonia. And what he started doing was treating his patients with this vaccine. And then he says, the results from the use of this vaccine have been marvelous. In every case where I saw the patient within 24 hours after the pneumonia chill and gave the vaccine, the temperature would be normal and the patient practically well, so far as the pneumonia was concerned, 48 hours thereafter. So in fact, he's saying this cured everybody within 2 days. He gives them some more examples of when he used that and the symptoms and the course of disease for the patients. And then he ends with this, really enthusiastic endorsement of this vaccine. I am thoroughly convinced of the wonderful results from this vaccine in the streptococcal pneumonia. I've been asked by my patients a number of times in the last few weeks to report the success of this vaccine through the papers, but I've been reluctant to do so. However, if you think well enough of the success I have had, you are at liberty to publish this letter, but the profession at large might at least give this particular vaccine a trial, as it cannot do harm, and to my mind, there is no question about the results. He does talk about four patients who died during the epidemic, although they were so sick that the vaccine was either not given or was given too late. The vaccine has come from laboratories. It's been around. It's nothing new to the profession. But as you can see from the beginning of this, he endorses it very, very enthusiastically. So, starting with this letter, I want to know a little bit more about Dr. Stevenson, because not much more obviously is provided in this letter. Fortunately, the Toronto Historical Society in their newsletter, actually from the summer, had a profile of Dr. Hacker U. Stevenson, born in 1872, educated at Richmond College, now University of Richmond, in the Medical College of Virginia. Began practicing in James City County in 1895, soon after he graduated. Very active in the local community, Board of Supervisors, Board of Directors of the hospital, elected to the House of Delegates for 2 terms, and basically ran this practice, small practice, for about 25 years, and then went to Richmond and was a medical advisor, worked for the Industrial Commission, and also was a surgeon for the railroad, and then died in 1949. So that gives you some background on him. and kind of what he was doing in 1920. I'm not sure the year for this photograph, but it's probably about this time. If you look at the census records from 1920, there's an entry for Hack U. Stevenson, head of the household, age 47. His wife Gertrude, four of the children who were alive at the time and lived in the house. And I was especially struck that under the column where the census lists occupation, he had both doctor and farmer, because he was obviously doing both. And so in 1918, during this epidemic, here you have a country physician who sees 450 patients in probably the space of 6 or 8 weeks. I mean, that's an extraordinary number. And so the question I had, and what I've used to set up this talk, is how do we think about this letter? And how do we think about the 1918 influenza epidemic, given what's happening now and where we are with the COVID epidemic in 2020? I think we can be very empathetic. When thinking about this doctor who confronts a sudden increase in cases and in deaths, leading to a strong desire to find some kind of effective vaccine, we might question his willingness to use an untested vaccine on sick patients during a health crisis without any protocols, to protect the human subjects and no control group, right? I mean, he injected the subjects and then decided based on whether they got better, that it was working. So there was not any kind of a trial or anything else. But especially the eagerness with which he wants to share these results with other physicians and with the public by documenting the trial and these outcomes. And so this is why in the article he talks about the number of patients who were sick, the number who were treated, the course of treatment, how long it took them to get better. And especially this idea that it's his patients who are telling him, you need to tell others about the results of using this vaccine, which of course he does. And he puts this in the letter to the Virginia Medical Monthly, which is a way to communicate within the profession, with other doctors, with public health authorities, and so on. And so, like I said, I think we can be very empathetic to the challenge that he's facing. As we think about epidemics and vaccines now, we should probably be skeptical and maybe even concerned about the lack of a protocol or attention to human subjects, or concern about alternative or adverse outcomes. And we can certainly appreciate this eagerness to find a vaccine. This is certainly something that we're going through right now. And so these were some of the ways that I wanted to think about the 19 influenza epidemic and the search for a vaccine. I am going to put up some disclaimers. I'm not going to give any medical advice on vaccines. I am not a physician. If you want advice on vaccines, talk to your doctor or your pharmacist. I'm not going to make any predictions on when a COVID vaccine will be available, or whether it will be effective. I think we're all trying to figure that out right now. And I'm certainly not going to comment on the politics of COVID vaccines, which I'm sure have become a kind of hot issue. I don't think it's appropriate either for this platform in terms of the Science Museum, and certainly in terms of my expertise. I'm a historian. I'm interested in how people thought about these issues in a historical context, and what lessons we can learn from that, but not so much to make comments on how those issues matter in the present. So I'm gonna hold off on that, and if there are questions on that, I think Jim is going to help me on that. Okay, so one way to think about the 1918 influenza is in terms of a narrative, in terms of a chronology. And this is an event that actually can be illustrated really well with data, with statistics. So this is the city of Richmond, deaths from all causes by month from 1917 through 1919. And what you see from January 1917 right through July of 1918 is a whole lot of stability. It really doesn't change very much for a year and a half. Starting in September, there's an extraordinary spike in the number of deaths. And again, these are deaths from all causes. And then that lasts about a month, 2 months. And then already by November, it's decreased. There's a second increase in December, and then it gradually kind of drops down in January, February. And then by March and April of 1918, the deaths are right back to pretty normal levels. And so when we talk about the epidemic of 1918, technically we could say 1918 to 1919, but it's really about a 6-month period. It starts in September 1918 with this extraordinary increase in deaths. but then decreases, rises again, and then decreases again to February of 1919. And this is the time when physicians and the public all over the country, including in Virginia, became very, very interested in the vaccine for obvious reasons. These were extraordinary number of deaths. How do we deal with them? And so, of course, if we were to put the date on Dr. Stevenson's letter, which was written on November 7th, 1918, it's published in December, but it's got a date of November 7th. This is the time period he's talking about. And in fact, those 450 cases, he probably saw them in about a 6-week period, from the late September through the beginning of November. If you break that out, that's an awful lot of cases in the week of just this one disease. So this is exactly what he's talking about. We can narrow this a little bit more. This is a different set of data, also for the city of Richmond. But these are deaths from just 2 causes, pneumonia and influenza, by week from the middle of September through December 21st, 1918. So last 3.5 months of the year. And again, you see this extraordinary rise, starting in the week that ends October 5th, October 12th, October 19th, and then a gradual decrease in the weeks that followed. And again, this is exactly the time period, when we think about both the influenza epidemic, but also that Dr. Stevenson is writing about. Now, this gets tricky because it depends on which time period Dr. Stevenson is using this vaccine, right? Again, so we're looking at the city of Richmond. These are not James City County where he's treating patients. But if the vaccine is being given at the early stage of this rise, that's really significant if it's decreasing the number of deaths. If you're giving out the vaccine on the downward slope, then you may be seeing fewer deaths, but it's not necessarily due to the vaccine. And so one of the questions that we can ask about 1918 is, when is the vaccine being used, and how does this timing affect the way that the effectiveness of the vaccine was being evaluated? It makes a very big difference whether you are doing this at the onset of an epidemic and hoping, we use the phrase now, to flatten the curve, or are you using this in the latter part of an epidemic when that decrease may already be happening? And we don't know because we don't have a week-by-week breakdown for Dr. Stevenson. All we know is that when he wrote this letter on November 7th, he was saying, I've been giving the vaccine and a lot fewer patients are getting really sick or dying. So I want to think about vaccines in Virginia in 1918 in terms of kind of 3 case studies. 3 examples. One is an announcement sent by the Virginia Board of Health across the state about the use of what was called Budd's vaccine, Dr. Budd at the Virginia Medical College, and how this was not only disseminated by the Board of Health, but publicized, reported in local newspapers. I want to talk about the test of a pneumonia vaccine that was done at Camp Lee, just outside of Richmond, in December 1918, and then finish by talking about an editorial also in the Virginia Medical Monthly in January 1919 about how important it was not just to have a vaccine, but one that was effective and reliable. So those are the 3 case studies I'll be talking about here in the remainder of this talk. The report on Budd's vaccine appeared in a number of different newspapers. This one comes from the Evening Leader from Stanton, October 19th, 1918. Very positive headline: has found a serum that works wonders. Of course, you would read that article if you were in the midst of a deadly influenza epidemic. And I've just highlighted some things from this article. It comes out of Richmond, but this was a Stanton newspaper. The State Board of Health has not felt that it can make any recommendations as to a definite method of treatment for influenza and pneumonia. Right. So here's the Board of Health about a month into this epidemic, basically saying we don't know what to do. We don't know what to recommend about these diseases. But this doctor has administered this serum to 20 patients, 2 of whom were practically in a dying condition. Only those 2 died. And then the other cases, the results in the other cases are declared by prominent conservative physicians to be little short of miraculous. So, of course, there's 2 ways to read this. One is, yes, this is miraculous. There were 20 patients who received this serum, and 18 of them survived, and therefore it must be effective. But at the same time, 20 is a really small sample. That's just not very many. And how many of these patients would have survived without the vaccine? How do you measure whether the vaccine itself is having this effect? Well, you have to do this, first of all, with some kind of control group, patients who don't get the vaccine. And more importantly, you need to do this with much larger numbers. So it's interesting that both in the report of these physicians who are described as both prominent and conservative, and then in the publication, the dissemination of this information by the Board of Health in the newspapers, they're very eager to declare this to be miraculous, that this is a wonderful treatment. The main thing that this serum was promised to do was actually not to prevent or cure influenza, but rather to limit the effect of limit the likelihood that influenza would turn into pneumonia, and that pneumonia would actually bring about the death of the patient. So they're not making any claims about influenza vaccine per se, but it's much more about, in effect, preventing the worsening of these symptoms by patients getting pneumonia. But they're very eager, the Board of Health, to send out this vaccine across the state, and to make it available to physicians, to the Board of Health, and so on. And you can see that this happened because about 2 weeks later, Big Stone Gap Post in Wise County, Virginia, published a front-page article, Try Bud's Vaccine. State Health Board mail sample to Virginia doctors. And again, this is a report that comes out of Richmond, but is republished, across the state by these local newspapers, bringing this information, right into the homes and offices of citizens dealing with this epidemic. But what's really striking here is some pretty contradictory information that's coming from the Board of Health. On the one hand, they're very positive. So the first sentence, it is the consensus of opinion among Richmond physicians that the pneumonia prophylactic vaccine is of decided value. And the last sentence, Dr. Budd's conclusions are that this vaccine given in the early stages of influenza is proving of unquestionable value in reducing the incidence of pneumonia. But then in the middle, there's a much more equivocal statement. It's left the judgment of physicians as to whether or not they are to use Budd's vaccine. So on the one hand, the Board of Health is saying, we think this is effective. We think this is valuable. The inventor of this vaccine, Dr. Budd, is saying it's unquestionable. It's of unquestionable value in reducing the incidence of pneumonia. And yet the Board of Health itself says, well, it's up to doctors to decide whether or not to use this vaccine. And presumably it's these instructions on this vaccine that Dr. Stevenson used on his own patients. But you can see some of the ambiguity in the way that not only the distribution of the vaccine was taking place, but also in how it was being recommended by the State Board of Health. And you can certainly imagine, physicians trying to decide whether or not they should use it on their patients, but also patients probably asking for this vaccine, particularly if they see it in the newspaper. And then what do you do as a doctor? Do you say, well, I don't know if I trust it or not, or do you give it to them? There's all kinds of dilemmas that come out in the way that this vaccine was being handled. The second case I'm going to talk about is at Camp Lee, and this was suggested entirely by this photograph, which I got from something called the Fort Lee Traveler, which is a local newsletter about Fort Lee, Virginia, or Camp Lee as it was called in 1918. And the caption, as you can see at the bottom there, men at Camp Lee, Petersburg, Virginia, after being vaccinated. It doesn't actually say it's a flu vaccine, but the date, and there's no month on the photograph, but certainly the suggestion is that this is the flu vaccine. And what you can see in the photograph, are these men showing their left arms or left shoulders where they've gotten this vaccine with pretty significant bruising. Not quite sure what the dog is doing in the picture, but it's nonetheless, something to look at. So the question I had was, well, what happened at Camp Lee? And the important thing to realize about Camp Lee is it grows tremendously during the war. Already by the start of 1918, so just 8 months after the U.S. goes into the war in April 1917, there's already 30,000 men at this camp. Numbers pretty much stay at that level until the spring of 1918, when there's a really significant increase, April, May, June, on July, peaking in July. So these are men who are being brought from all over the East Coast for training at Camp Lee, And then they go from Camp Lee onto ships, and then they go across the Atlantic to the European front lines. So the numbers go up. They also, as more men come in, they also go down as men leave to get on these troop ships, and then more men come in. What's significant about this timing is, that Camp Lee is at kind of maximum capacity right when the influenza epidemic reaches the United States in late August into September and October. And so you have this concentration of 40,000 men in tents, in barracks, in a pretty small space. And it's, just the worst possible setting for rapid transmission of an infectious disease. As you can see, by November and December, the numbers have gone down significantly, obviously, as the United States, as the war ends, and the United States starts reducing its training and so on. The physicians at the time were, of course, very, very aware of this. There's a comprehensive study done in the 1920s. The medical department of the United States Army in the World War. At the time, we only had one World War, where they really looked very closely at the influenza epidemic in these army camps, all over the United States. And what happened, this shows the information in this table, specifically at Camp Lee, almost 13,597 cases of influenza and pneumonia in the period from September 13th to November 10th. So 8 weeks, almost 14,000 men were sick with either influenza or pneumonia. About a quarter of the men in this camp at various times were sick. The total deaths, 674, which works out to be about a 5% case fatality rate, which is very, very high. 5% of those who were sick who got sick died from this disease, one of these two diseases. If you think about it, out of the 50,000 men, more or less, 674 dying is, around 1%. You think, well, maybe that's not so much. But think about it, if you were in Camp Lee in 1918, you were a young man who had passed a physical when you were drafted. You should have been in, pretty good health, possibly the best health of your life. And yet here you are dying of either influenza or pneumonia, which are not diseases that usually cause death for young, healthy people. And so this was what the Army physicians were shocked by. They were astonished. They were confused, and they were desperate to figure out what had happened and what to do about it. And so this is what leads in December of 1918 to this test of about 200 soldiers at Camp Lee to be inoculated, with this vaccine to prevent pneumonia, or as it was known colorfully, the captain of the Man of Death. And they praise an earlier test of this done in the Army to half of a division, which is a lot more men than the 20 that Dr. Budd had been testing the vaccine on. Over the period of about 10 weeks. Here they actually had a control group, those who are vaccinated, those who were unvaccinated. And the ones who were vaccinated got sick less frequently than those who were unvaccinated. So you can see in this article from the Richmond Times-Dispatch about this testing of inoculation at Camp Lee, in an effort to address some of the concerns I brought up earlier, a larger sample, a control group, a longer period of time, and on this basis to say that it was worth trying this out on these 200 soldiers in Camp Lee, which presumably would have included some of those men who were showing off their arms. But here again, we need to think about the timing of when this vaccine happened. So the chart on the left, shows you approximately the period of the influenza epidemic from late August through the spring of 1919. And as you can see, again, much as we saw with Richmond, there's a dramatic increase. In this case, it's in admissions, that is, men who were sick enough to be admitted to the hospital within their camps, and then also in the number of deaths, both from in the United States is what we're looking at here. So once again, you have to think about when the vaccine was administered. If you're administering the vaccine very early on in this epidemic and you're having success in bringing down the infection rate and especially the death rate, that's a very good sign. If you're testing the vaccine towards the end of that cycle, when there are already many, many fewer people being infected or dying, then it's harder to determine whether the vaccine itself is the cause of this decrease. And so anytime we think about not only about vaccine trials, and especially about measuring effectiveness across a large social group, we really need to think about these kind of cycles of infection and these trajectories and where these trials are happening. This is a similar indication here, looking at influenza admission rates. And again, if you kind of mark, as I have done, where this testing was happening at Camp Lee, you can see there had already been a significant decrease in admissions. There's starting to be a slight rise again. So that was something that the physicians obviously were concerned about. So these are some ways to think about that. I'm going to finish with this example, which also comes from the Virginia Medical Monthly in January of 1919. It's an editorial that looks at this question of prophylactic inoculations against influenza. And I've just highlighted some parts of the text by Dr. Alex Brown, who calls the need for a prophylactic inoculation of a serum or vaccine against influenza and its deadly complication, pneumonitis, is the most urgent of the hour. He's saying this is our most urgent health problem. We have to deal with this. If the current reports are true, 6 million people in the world have died of influenza since the epidemic began. 350,000 people in the United States of America have died of it within the past 4 months. So these numbers are way too low. Current estimates of the global number of deaths are closer to 50 million. And in the United States, the total death toll is estimated closer to 650,000. Now, partly that 650,000 usually includes deaths in 1919, whereas Dr. Brown is writing this obviously at the end of 1918. But still, this is how he's measuring the impact of this epidemic. Think about the number of people who have died in the world, in the United States, in this short period of time. The professional and scientific world stands all but overwhelmed by it and apparently powerless to forestall a repetition of it within the present winter season or in succeeding years. So in effect, he's saying, this is, the deadliest scourge or plague we've ever seen, and we don't know what to do about it. We are overwhelmed by it, and we are powerless to prevent it from happening again. He talks in here. He quotes from William Harvey. All we know is still infinitely less than still remains unknown. And that's a pretty striking statement coming towards the end of this epidemic. He's saying, even though we know a lot, there's so much more we don't know. Science and scientific men must feel the weakness and insufficiency of scientific knowledge and power. And then he ends, with this call for action, for meaningful change. Public health officials and private practitioners, like Dr. Stevenson, feel the need of some measure or agent which may be used, at least in the presence of cases of influenza and epidemics, to prevent exposed persons from taking the influenza. Were it known that there's an obtainable, safe prophylactic vaccine or serum, no greater boon could befall the people than to be able to resort to it when exposed to influenza or even when precaution seems to demand its use. So every probable vaccine or serum guaranteeing no deleterious or harmful effects when used based upon fairly sound reason and scientific procedure, which may be offered by scientific workers, should receive hearty reception and a just and fair trial. In fact, every real investigator should be welcomed with his vaccine or his serum if produced along scientific lines. So you see continuity here with the letter I started with from Dr. Stevenson, with the articles about Dr. Budd's vaccine and the trials at Camp Lee. They are desperate for a vaccine. They are desperate for some kind of treatment. But this editorial is more cautious, certainly about requiring, scientific procedures and making sure that these vaccines are effective and safe before they're recommended out to practitioners. So, as I think about this topic and think about what lessons can we learn from 1918 for the situation we're facing in 2020, these are the 4 that I came up with. We can understand the powerful desire for a vaccine that will prevent the spread of infection, cure disease, and allow a return to normal behavior. And we're all living through that now. We certainly see evidence of that in 1918. But we also must recognize that testing a vaccine must adhere to scientific methods and must be proven effective and safe before distribution to populations. And the editorial from Virginia Medical Monthly made that very, very clear. Plans for vaccine distribution must recognize differential levels of risk, prioritize healthcare workers, and ensure justice and equity in distribution. That was not such an issue in 1918, but the absence of that is really striking. And developing, testing, and distributing vaccines during an epidemic can bring a sense of urgency, but also the potential for premature claims of success. And I would argue that both Dr. Stevenson, the Board of Health, in advocating Bud's vaccine, and certainly the physicians at Camp Lee, were very eager to find this evidence of success and to proclaim it, but they probably did it too soon. And in fact, subsequent studies made it pretty clear that there was no effective vaccine for influenza during this epidemic. In fact, that doesn't come until much, much later in the 20th century. There was some success in preventing influenza from turning into bacteria, and that's really what those vaccines were focusing on. But I think these are useful lessons for us to think about. And I guess I'm really struck by the quote from William Harvey that appeared in that Virginia Medical Monthly editorial. As we go, we've now passed our sixth month of dealing with COVID. We have learned so much about the disease, about transmission, about infection, about the effectiveness of masks, which I talked about last time, and social distancing. But yet there's still so much we don't know about the disease and what to do with it. And I think we're going to be living with that for a while yet. So I'm going to stop there. I'm happy to take questions that Jim has been gathering. Thank you very much.
So can you describe a little bit about what the conditions would have been like at Camp Lee when it was packed with all these soldiers?
Packed is a good word. Yeah, I don't know exactly how long they stayed there, and it probably varied. But there's a museum at Camp Lee that has some photographs of the camp and the tents. I mean, it was densely populated. The men were often did their initial training when they were first conscripted elsewhere in the country. They were brought to Camp Lee and kind of concentrated there, and then moved. Probably most of them left on ships out of Newport News. The three major ports for sending troops to Europe were Newport News, Philadelphia, New York, and out of Boston. But these were also the camps where the camps had the earliest and the worst outbreaks of influenza. And in fact, one of the things that the city of Richmond tried to do pretty early on in the epidemic was actually try and quarantine Camp Lee and keep civilians from going to the camp, keep the soldiers from leaving the camp and coming into Richmond. But that failed. By the time they were even talking about that, there was already infection spread throughout the civilian population. And, some of the most gripping and disturbing accounts of the influenza epidemic come from the Army doctors, because they dealt with the worst cases earliest. And it was really distressing to them to see these, young, healthy men who were so sick so quickly, and so many of them were dying. And I think that was a really significant moment in this epidemic, when these Army physicians realized just how deadly this disease was, even for those who were healthy. I hope that helps.
Absolutely, yes. So can you talk a little bit more about how the flu and pneumonia kind of went together?
Yeah, that's a good question. We're going to quickly get out of my area of expertise as a historian. Influenza in 1918 was a lot like seasonal influenza. And again, in the early stages, the public health officials, including the Surgeon General, really discounted the threat, because they thought it was just kind of like regular influenza. People would be sick for a couple of days, they'd have a fever, they'd have chills, they'd be tired, and then they'd get better. And to go back to an earlier point, this was what the Army physicians realized wasn't happening. These men were getting sick with a fever, and instead of getting over and getting better, they were getting sicker and sicker. And so the pneumonia comes when the influenza, weakens the body's resistance, and it becomes susceptible to bacterial pneumonia. And then this was what was causing many of these men to die. Again, especially in the Army camps, the young men. But again, if you think about Dr. Stevenson's practice, in a rural part of Virginia, it was very normal for him to deal with seasonal influenza. But he probably expected that most people who got it wouldn't be that sick and would get better. He certainly had no idea, that in a 6-week period, he'd have 400, 500 cases of this disease. And so that's the thing they really had trouble understanding. And the research was pretty good about this. If you read these medical journal articles, including some of the ones that I cited here, they've got a pretty good technical medical explanation of what's happening. What they had a harder time understanding, explaining, was kind of how this was spreading so quickly through society. Why were these people who were seemingly healthy suddenly becoming so sick?
Okay, so I think we got time for about one more here because I know you have to get going. So specifically what they were trying to do is prevent the pneumonia from developing, not necessarily prevent the flu itself when they were vaccinating people who were already sick.
Yes. Yeah. I mean, there's discussion about a vaccine that would actually prevent influenza or treat influenza. But that's probably more common in newspapers and in general discussion. The doctors and the researchers knew that's not what they were going to be able to do with their vaccine, but they were very optimistic that they could prevent the influenza from turning into pneumonia. And that's what Dr. Stevenson was saying based on his practice. That's what the State Board of Health was saying. And I think what interests me, in looking at these materials from 1918 and understanding it from the perspective of where we are now, is how they were, even though kind of professionally and as experts, they were being cautious, those quickly turned into a much more positive and optimistic message once it went out into the newspapers. And again, that kind of language of the hope for a serum, and the marvelous results. I think that's the part that kind of really sticks out as I read through these sources.
Well, it looks like we're just about out of time for today. Dr. Ewing, thank you so much for being with us again. It was a pleasure to have you back.
Thank you.
Thank you all for joining us. Thanks to Dr. Ewing for helping us discover more about our world. Please join us next week on October 7th at noon for RV Air, a science initiative to understand Richmond's air quality, presented by Devin Jefferson, Community Science Catalyst, here at the Science Museum of Virginia. So what this is an ongoing citizen science project we've been doing here at the Science Museum to send volunteers out to take air samples to figure out what's going on with the air quality in Richmond. Devin Jefferson will be discussing basically the preliminary results and the data that have come from that. So definitely do encourage you to check that out. So you can register for next week's talk at smv.org. Each talk is free to attend and is open to the first 300 registrants. Thank you again for joining us today. Until next week, stay safe and stay curious.